Welcome to Health Yeah, where experts from Stony Brook Medicine come together to discuss topics ranging from the complex inner workings of an infectious disease to tips and tricks for staying safe and healthy all year long.
Welcome to Health Yeah, where we break down important health topics in a way that's easy to understand and actually useful. Today we're talking about something that doesn't always get a lot of attention, but definitely should, and that's deep vein thrombosis, or DVT. DVT is a serious condition where blood clots form in deep veins, usually in the legs. If left untreated, these clots can break loose and travel to the lungs, causing a life-threatening pulmonary embolism. So, whether you sit for long periods at work, travel often, or just want to know the signs to look out for, this episode is for you. Join us today. We have Dr. Matthew Pergamo and Dr. Angela Kokosis. And I want to start the program with just having each of you introduce yourselves to the audience and telling us a little bit about what you do here at Stony Brook Medicine. And Dr. Kokosis, since you're directly to my right, I'll have you start.
Absolutely. Thank you for having me here. I am one of the vascular surgeons here in the Division of Vascular and Endovascular Surgery, and I'm also the medical director for our DVT VTE team.
Great.
Yep. And I'm Dr. Matthew Pergamo. I just started actually in August. I'm also a vascular surgeon here at the Division of Endovascular and Vascular Surgery.
So you just started in August. Are you from the area?
My wife is from Long Island. I actually grew up upstate, and I did my fellowship in the city.
All right. I just was curious. So let's talk about DVT and VTE. So we mentioned DVT in the open. What is VTE?
So VTE stands for venous thromboembolism, and that's when a blood clot, or what's a DVT, a deep venous thrombosis, actually travels in the vein to another location. And so that can mean a variety of areas. Most commonly when people hear about it, they hear about it going to the lungs and blocking blood flow there.
And Dr. Kokosis, when it goes to the lungs, what happens? What does that actually do?
Absolutely. So typically the initial signs and symptoms are patients may feel chest pain, shortness of breath. Those could be some early signs, but you definitely want to pick up on it as soon as possible because it can be life-threatening. Yeah,
it's a serious condition, and can you tell before it gets to that really serious stage?
Yeah, absolutely. So if it started as a DVT, and most commonly DVTs do start in the legs, less commonly in the arms, essentially what you may notice is that you have swelling or pain in one leg, and that may be the early sign.
I actually worked with somebody many, many years ago who died from a DVT, and it was devastating to his family, two young girls, and he was seated in a vehicle actually in Desert Storm for an extended period of time and developed that. Is that common when you're seated, when you're traveling? It seems like we hear about these things on airplanes as well.
Yeah, absolutely. I would call it the perfect storm, where obviously not everybody who travels on long trips is going to develop a DVT. But let's just say you're on a particularly long trip, you don't move, you're dehydrated. Those certain events could increase your risk. And then, of course, if you have some underlying predisposition that you don't know about, that could add to the risk.
And Dr. Pergamo, talk about the dehydration aspect of this. That's interesting. Why is that such a critical part of this?
Yeah, so when you're dehydrated, there's a few factors that go into that. One of them is that your blood volume is a little bit less, so your vessels are a little bit smaller, meaning that there's a little more stagnant flow throughout them and slower blood flow. Usually your blood pressure is a little bit lower. The other factor in that is there's as a result of having less water, the water content of your blood likely goes down a little bit. That makes you a little more prone to being what's called hypercoagulable, meaning that the factors in your blood that cause the blood clot are more likely to encounter each other, stick together in a weird way, stick to the blood vessel wall, or form a blood clot.
Interesting. And I would imagine just being seated, it just sounds logical that your blood isn't moving as much, your heart's not pumping as much, you're not being active. Would that be accurate?
Yeah, so, the calf muscle pump is such an important part of our body as far as circulation. So if you're not actually walking or moving, then your calf muscle's not working. And that's what actually helps eject the blood from your legs and push it up toward the heart.
That's interesting. I had no idea. I always figured your heart muscle was the one that does all of the work, but other areas help.
Absolutely.
See, I learned something today, so that's great. Hopefully people at home learn something as well. So what are some of the early symptoms? And, again, oftentimes I'll be in my car, or I'm probably a bigger culprit is I'm sitting at my desk for hours. Is there something that I'll notice?
So I'd say that the most early symptom is going to be just discomfort, and that's before
in your leg.
Yeah, or it could be in any part of your body. You can get a DVT in your arm, for example. It's a common thing that happens with swimmers or pitchers. If they repeatedly use their arm, they can get DVTs in their arms. It's a bit of a different syndrome, but the first thing that I've heard patients describe to me is that their limb just felt uncomfortable and not really like it, like their own. And it's hard to say because, like, if you've been sitting a long time, you're going to be uncomfortable. So your legs might just feel awkward when you first get up. But it's that discomfort that persists, that keeps going on that I think most people first encounter.
I have heard that sitting is kind of the new smoking, or, people say that. I don't know if that's accurate or not, but we'll throw it out there. First of all, is that accurate? Is it that unhealthy for you to sit for extended period of times? And what should people do?
Yeah, absolutely. I mean, I think a lot of the technology that we have in this day and age has made it easier for us to sit. You get home deliveries for everything.
Yeah.
Most of our work is on computers. So, yeah, I would kind of agree with that statement.
Mm-hmm.
And yeah, sitting for extended hours is just overall not good for cardiovascular health. Yeah. You got to get up, move around. It's good for your heart, your lungs, your vessels. So,
yeah, every once in a while, I'll even get up and just do a lap through the through Health Sciences Center and through the hospital, just because you feel like you need to.
Absolutely.
So there are people that drive for a living, for example. You mentioned delivery folks, truck drivers, people like that. I would imagine they're at maybe a higher risk. Would that be accurate?
Yeah, if they're not taking breaks, in between those long haul trips, absolutely.
Is there anything you can do while you're driving to help, or do you just need to stop the car and get out?
Yeah, I mean, naturally you're usually using one foot on the pedal. The other foot, you could just, pump your foot up and down, flexing your calf muscle that, mimics the action of walking. Similarly, when you're on a long trip on an airplane, you could do the same.
Yeah, I would say also for, truck drivers, if you're on a highway, obviously you want to be safe driving and don't do anything unsafe, but there's cruise control and you can take a couple seconds break, put that on to keep your speed going while you, move your right leg to be able to...
your legs around, yeah.
Yeah, to move them around and then, take it off and keep driving.
So the question, and it's always interesting because we get these questions primarily from folks that are searching online. So it's always interesting to me to see what the questions are. One of these is, how do you test for DVT at home? Can you do that even? And when do you need to see a doctor?
Yeah. I mean, there's no real home test per se, but I would say you could do a self-exam, meaning if you feel that your leg is, a little painful, a little swollen, and if you squeeze it and it hurts with squeezing, that could be an early sign. And then you should seek medical attention.
And is it true also that if your skin gets a little warm in that area, is that another sign?
Absolutely. Warmth and sometimes discoloration. So patients may notice that their skin looks a little redder or a little purpler.
If you feel these symptoms, you go see one of you. What is the survival rate for folks that catch it?
So survival rate for DVT on diagnosis is actually very good. It's the undiagnosed ones that have the risk to progression for pulmonary embolism. So, I mean, just to give you an example, the opposite of your question, pulmonary embolism has a 20% fatality rate. So that's pretty high.
That's significant, yeah.
Yeah. So you really want to seek attention as early as possible.
And what happens when somebody comes to see one of you? What's the process that they go through, and how do you fix this?
I mean, the first thing is always a physical exam, right? To test, and usually you see some kind of size discrepancy in their legs. There's swelling on one side, or like I said, if it's in the upper extremity, you see that one arm is significantly more swollen than the other. And then we do imaging, and the main imaging modality for DVT or blood clots is ultrasound. Looking at the deep veins. And so that's a non-invasive test. It uses sound waves to look at, whether or not there's blood flow through the veins. And if, the tech that usually tries to push down on the vein, if they can't collapse it, they'll know that there's a blood clot there. And that'll, prove the diagnosis.
And then what happens?
After that, the first thing that happens is usually a patient gets put on blood thinners, and that's the mainstay of treatment. And for the majority of people, blood thinners is enough to treat their blood clot. It kind of stabilizes things, stops them from getting worse, and begins to treat, even if they've had a small pulmonary embolism, it starts to treat that.
And if it gets to the stage where they need to see a surgeon, does that happen very often or not?
Not often. In cases of really extensive DVT where the clot is essentially the entire limb and up into the pelvis area, those are really the cases where they may need a surgical treatment to remove some of the clot. Reason being, those patients may have such severe symptoms of pain and swelling that it would take a long time for them to wait for the clot to dissolve with the blood thinners.
And if you are taking the blood thinners, is there a concern that the clot could come loose and cause issues or not so much?
That's a great question because many people ask just that. Intuitively, they think, well, now the clot is going to become more mobile and it's going to break off. The risk is actually less because the idea of the blood thinners is it dissolves it, prevents it from getting worse. So
interesting. So, it's very interesting you bring up the DVTs in the arms because I'd never really even thought that much about that. I always thought of legs. Is that common, or very common, or is it primarily legs, or do you see a lot in the arms?
It's definitely more rare than the legs, but, the reason for it is usually so it's called an element of obstruction is the cause of it. So usually they have a rib that's pushing on the vein coming from their arm. And, in somebody who's like a pitcher, like I mentioned, or a swimmer, when they overuse that arm and they are irritating that spot where the vein is going through their rib, causes a little bit of blood clot, and then that kind of cascades and clots up their arm. So usually it's in younger patients in more of a special subset than, most other DVTs of like the legs.
So I'm not wearing my watch. Well, I'm wearing a watch, but not the watch that tells me to stand up right now. It bugs me. I'll be real honest with you, because every hour you get the little notification, usually in a meeting or something like that. So I turn mine off. Probably not the way to do it, but every hour, is that a good school of thought for getting up and getting around and trying to prevent things like this from happening?
Yeah, absolutely. I think that's healthy. If you could do every hour, you're in good shape. If it's 2 hours later, it's not the worst thing, but yeah, it's a good habit.
So I need to turn that back on my watch, I guess. Okay. A final question. You guys, first of all, have been great. This has been very interesting. I've learned multiple new things today, which is always important and good. Hopefully our viewers have as well. Can DVT be prevented, though? If you're one of these long-haul drivers, a traveler, sometimes people will fly overseas. I know we've had some tips. Can you really prevent it, or does it sometimes just happen and you have to be aware?
I would say for like the ones that have a cause from immobility or, some mechanical cause like that, I would say that those are for the most part preventable as long as you're moving around and kind of keeping your blood flow going. I would say for other people who have a genetic predisposition to getting them, they have a family history of blood clots or pulmonary embolism, that sometimes, they sit the same amount as another person would, and they might put themselves at risk of a blood clot, and there's not much that they could do to prevent that.
And if you do have a family history, I would imagine there are things you could do, blood thinners, things like that.
Absolutely. And also there's genetic testing depending on what the inheritance pattern is. Mm-hmm. There are some, genetic mutations that are well known to predispose people to clotting. Yeah. And, just as an aside, I'd throw out there, sometimes a DVT can be a harbinger for a cancer. A malignancy.
Really?
So oftentimes when we work up these patients, we really get an in-depth history to make sure we've determined what the exact cause of the DVT is. And if there's no obvious reason, then we start to look a little more deeper. Blood tests, cancers, and things like that.
Interesting. Okay. Well, there's another thing I learned today. This is great. You guys have been very, very helpful. We really appreciate it.
Thank you.
Thanks.
All right. That's it for today's episode of Health Yeah. Deep vein thrombosis is serious, but the good news is that awareness and simple lifestyle changes can make a big difference in prevention. I will turn my watch back on. Thanks for tuning in. If you found this episode helpful, share it with a friend. And please make sure you subscribe for more health tips that can keep you educated and empowered. Until next time, stay informed and stay healthy.
Stony Brook Medicine is Long Island's premier academic medical center. We transform lives through scientific discovery, education, and care, and we bring together innovative research, advanced education, and extraordinary healthcare expertise to set the standard for how healthy communities thrive. For more information, visit stonybrookmedicine.edu or follow us on social media, Stony Brook Medicine on Instagram, Threads, Facebook, YouTube, and LinkedIn, and Stony Brook Med on X.